Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Reform Advocacy, where we face problems in the healthcare system and take actions to try and make it better for all of us. I want to point out that in the description section below, I'm going to have a link to a Healthcare Advocacy Newsletter, which I wrote, that is essentially the text for this video. Every link that I mention in the video will be in that newsletter, so please make use of it. Now, a friend of mine, John, lives in Arizona, and he and his wife have been traveling to Mexico for years for dental care. They pay far less than they would in the United States. There's a video link, which you'll get below, that has a story about one small town across the border in Mexico that caters to the American, to the U.S. dental trade. 50 years ago, one dentist set up shop there to treat people from the U.S. They now have hundreds of businesses building up the dental trade and tons of dentists providing quality care. That's not too unusual to think of, but the part that I was amazed by is that they pay less in cash in Mexico than they would pay using their dental insurance in the United States, accounting for copays and the like. Just think about it. Let's talk briefly about universal health care. There's been a step forward in California last week. Governor Gavin Newsom signed a bill moving California a little closer to developing its own healthcare system. There'll be a link to an LA Times story about it. The law would help California obtain waivers that would let them allocate Medicaid and Medicare funds into a single-payer system that would cover everybody in the state. I believe it also covers waivers to ERISA, which is the Employee Retirement Income Security Act, a mouthful. That act prevents states from modifying benefits that employees get if their employer operates across state lines. So you would need that waiver to make single payer work. California's health secretary has to offer recommendations on building the federal waivers by June 1st, 2024 under Senate Bill 770, and the state will now put together a design for it. If anybody in California is listening, I would point out to you that the state of Oregon has crafted their letter for waivers, and it is available at the state's website online. Regarding Washington State, we are trying, where I live in Washington, we are trying to put together a similar bill to what California has. It is called SJM 8006, and I wrote about it in the Healthcare Advocacy a week or so ago, and there's a link to that article in the newsletter that is going to be in the description. And if you're in the state of Washington, I sure would appreciate it if you would open up that link, find the action, because in there is an action where you can contact the leaders of the Senate and the House in the state of Washington and ask them to bring that bill up for a vote. So that would be good. Now, while we're talking about universal health care and the states, I want to point out to you that it's important that we push forward on all fronts, at the state level and at the federal level. The way it may work out is that some state may actually build a single payer system that serves as an example to other states and the federal government to help them implement. And it's worked that way in other countries. Anyway, there's an organization called One Payer States, and their national website focuses on getting individual states to move forward with single payer locally in their state. And again, their link will be in that newsletter. I would also like to point out that I put a link into a page they have which has an interactive map of the United States. It is green colored states and blue colored states, and the green states have local regional organizations working to make single payer health insurance a reality. And I think when I counted, there were about 18 of them. And if you click on those states on the page, you can see what the local organization is up to. You can get some information on them, see what legislation's underway, and you can see how you can be involved. If you're having trouble with the map, once you get to one-payer states, in their upper right corner, they have a tab that says States, and if you just click on that, on the drop-down, you can find your state and see where you can get involved. I recommend having a look, and if it's possible for you, get involved. That's a really good organization. Let's talk about COVID news. A recent Kaiser Family Foundation poll found that about half of all adults are planning to get the new COVID vaccine in the US. Well, that's good, but it's only half, and that could be better. Still, what it points out is that so many of us don't trust the efficacy of vaccination. It seems that Republicans have a harder time believing that COVID or flu or RSV vaccines are effective. In the links, you'll find a graph that shows how much Republicans distrust vaccination compared to Democrats. Let me just give you one example. Democrats trust the COVID vaccine, 84%. Republicans, 36%. Democrats will get the COVID vaccine, 70%. Republicans, 24%. Now just remember that the COVID virus killed far more people in Republican states than in democratically controlled states. Word to the wise. You can draw your own conclusion. It's too much for me to think about, but I'm going to get the vaccine. Okay, in addition, since the data that the Kaiser Family Foundation put together covers RSV, flu, and COVID, there's also a link in the newsletter below from the CDC, and it is their guidance on RSV. And it's important because they don't recommend the RSV vaccine for everybody. They have a special inoculation for children, which actually adds immune antibodies to their system because they're so little, they don't have a full immune system. And it is recommended for people 60 and over and for pregnant women at a certain stage of gestation. Anyway, that's what I have for you today. I want to remind you, like this, share this, subscribe. You can subscribe to Healthcare Advocacy and get this as a newsletter in your inbox every day. Have a good evening.